We will begin with phrases from Nature and the New England Journal of Medicine. And then we will do some group work, and you can speak in Korean, that's okay. And then give the conclusion in English, okay? So, first are the kinds of words or phrases. Remember we talked about plagiarism and how sometimes you see a very nice paragraph or sentence and you want to take it. Well, in a way, we all learn writing in our own language by imitation, also speech. So it's only natural. But you cannot take whole paragraphs, right? So, first of all, I'll begin with Nature, and then New England Journal of Medicine, words that are used in the introduction, materials and methods, results, and discussion. That, to me, as a native speaker of English, are appealing and are maybe a little unusual for a non-native speaker to use. So they are attractive. The second part, I'll divide you into maybe 3 groups, and I will give you a situation, a real situation of an ethical problem. For example, a paper is submitted, reviewed, revised, accepted, published in electronic format, and it's about to be published in paper format when suddenly there's a letter from one of the authors, and he says he does not want to be associated with this paper. It's already published electronically. And so, well, why? Well, the reason, and this is true, the reason is the author was a guy, and one of the first named author was a girl, and the guy liked the girl, and the girl didn't like the guy. So she asked her boss if he agreed to the paper, and he said yes. She said. But anyway, she didn't want to go out with him, so he said, okay, I've got nothing to do with the paper. So what do you do? I mean, these are real situations. And then at the end, if you have any questions about phrasing, we can do that. Okay? So, first of all, Nature. You can say this more easily. You can say apeptides may be involved in Alzheimer's disease. Okay, one thing, it's Alzheimer's disease. Now we do not say Alzheimer's disease or Sjogren's syndrome. We say Sjogren syndrome, Alzheimer's disease, okay? The apostrophe S is not used now. Okay, evidence suggests, so you're getting into the middle and you're being told in a nice way that apeptides are causally involved. And when they say evidence suggests, that gives a very objective feeling that this is evidence that anybody can see. It's not my opinion, particularly evidence. Okay, and here we have the critical importance, okay? The critical importance of excess salt intake in hypertension is widely recognized, okay? But the mechanism by which has puzzled researchers. Okay, now puzzled is not a word that you see many non-native speakers using, okay? And it's quite okay to use it. It's a puzzle, okay? So it's something that we have to, that there's a problem. We don't know the answer. And many researchers have been puzzled, okay? And here's a kind of phrase that is used not only in Nature, but also in New England Journal. These data provide compelling evidence. Now, this phrase is a very strong phrase. To compel is to force. It's evidence that cannot be denied. So this is a very good phrase to say when you're sure that there is very strong evidence. There's compelling evidence. Okay? So that is appealing to the reviewer. That it's not just your opinion, there is actually strong evidence. And I like this word, elucidate. Elucidate, lus comes from light, looks, right? Elucidate, E is, over here you have the exit sign. X is out. So elucidate means bring out to the light. To elucidate. I like this word. We aim to, you can also say clarify, but elucidate is a little more academic. The molecular mechanism. And this is another phrase that is rarely used by non-native speakers, underscore or underline the potential value. Okay, so again here, this is a sort of phrase you would use in an introduction. Okay? Because what they're saying is, this is worthwhile researching. Okay, and that's why we're doing it. Remember, in the introduction, as I will tell you later in the New England Journal of Medicine, is you've got to establish the gap. What is known, what is not known, and what you're going to do about it. So this says why that it's valuable to do this. If it's characterized by thrombosis pregnancy, is a leading cause of miscarriage. Leading cause. Again, this would not be seen in most non-native speaker manuscripts. Is a major cause would be more common, or is a large cause, or is a frequent cause. But a leading cause. These words have a slight echo, a slight feeling of the person really knows the language and the topic. And it's reassuring to the reviewer that the person knows the topic and how to write about it. Again, compelling evidence suggests that ABO compatibility, or you can say historically. So you're just saying that in the history, just one word, but it has a lot of meaning. There are many reports saying that this is true. Just one, historically, comma. And this is important because most journals, just a couple of hours ago, I was going over the lecture we will hear next week by Dr. Klaus Rabe of the European Journal of Respiration. And in his lecture, it's a video lecture that you'll see, he shows, as I mentioned yesterday, he shows the actual forms, the actual papers they send to their reviewers because they want a uniform method of evaluation of papers. You don't want somebody saying, It's good for estimating something. You want, how new is it? How true is it? Does it change clinical practice? That's what many of the clinically oriented journals are looking for. Will this change clinical practice? If not, you can forget about the New England Journal of Medicine. The New England Journal of Medicine is a very good journal, but it's a very widely read journal. So they want to appeal to a very wide range of readers, not just GI specialists who might be interested in one single molecular pathway. They want something that will be really interesting to the general medical world, that will have a clinically relevant meaning. And the human immune maturation at birth is considered more advanced in mice, thus presumably beyond susceptibility. It is not affected by. But here they're putting in the word presumably, which means that's what people are saying, but maybe not. And they go on with nonetheless. Okay, presumably it's not affected by. However, so most non-native speakers would use however. Okay, please remember, you never begin a sentence with and or but. And or but are conjunctions. They join parts of sentences, okay? This is a mistake many native speakers make. Instead of and, use moreover or furthermore, or words like that. And instead of but, use however or nonetheless. Okay, this is rarely seen in non-native speaker papers. Nonetheless, nevertheless. And this has been supported by other studies. And, but it also suggests that the interactions have a degree of flexibility. So here you are introducing some doubt. Okay, maybe it's a bit flexible. Maybe it's not A equals B, 1 plus 1 equals 2. There's maybe some, what we call wiggle room. Do you know wiggle room? Wiggle room, wiggle means to go like this. So wiggle room means ability. If you say 1 plus 1 equals 2, then there's no wiggle room. If you say, in most cases, 1 plus 1 equals 2, then you have a little wiggle room. However, in quantum mechanics, you can. So sometimes it's best to give yourself some wiggle room. And here they're saying there is some wiggle room. There's a degree of flexibility. And this is another phrase, has emerged as a public health concern. Now, you could just say obesity is a public health concern, or has become, but has emerged sounds that it's gradually coming out naturally and is now being recognized as such. So again, here you are in the introduction saying what you're doing to investigate the essential role of ABC in XYZ. We did this. Right? So to investigate the essential role. And so this is an attractive way of saying this is why we did it. Again, this is another strong word, cornerstone. It's very rarely seen except in native speakers. A cornerstone is the foundation stone. In many buildings in probably Korea and also definitely in Japan, when they begin the building, they begin with a cornerstone and they carve. This building, construction was begun on the 28th of November 2013. That's the cornerstone on which everything rests. Are cornerstones in the pathogenesis of asthma. And therefore, to specifically evaluate, again, not just to evaluate, but specifically evaluate, we selectively inactivated or reconstituted these by doing this. Okay? So this is what we did, and this was the purpose. Again, you're bringing the reason. Many Asian writers would say, they would begin, we selectively inactivated or reconstituted to specifically evaluate this. But this is the whole reason for doing this. So you, again, as I was mentioning yesterday, front loading, bringing it to the front. This is the attention getter. Again, provides a new clue. And you're saying it's a new clue. You're not saying it's the answer. But you're saying it may be part of the answer. Or an important part of the answer. Physiological anti-inflammatory mechanisms and efficient that have been selected by evolution to control inflammation. Again, this part is the head of the sentence, and they have been selected by evolution for the control of inflammation. And these mechanisms may provide advantages that can be exploited, we can make use of. So, many people would say, we try to understand these mechanisms to enable the treatment of inflammatory disorders, which is okay. It's the same meaning. But these mechanisms may provide advantages. Oh, that's good. I want an advantage, right? That can be exploited, can be made use of. Again, I'm going to profit if I do this. So it's motivating. It's motivating in terms of science, and it's motivating the reviewer or the reader to keep reading. And previous studies, they've suggested this. Therefore, future studies are required to determine the specific regulation of HMGB1 acetylation during sepsis. So again, you're saying this is the reason, therefore this is needed. And this is also commonly seen in Nature NEJM journal, British Medical Journal. Further investigation is warranted. Warranted means we need it. And this comes from the word warrant, meaning a document for the police to arrest a person. I have a warrant for your arrest. The judge has signed that you should be arrested. Okay, that's a warrant. So I am warranted in arresting you and taking you to the police station. So it's quite a strong word, and it's not so common among non-native speakers. And again, a framework for understanding, you're saying that, okay, we're trying to give you an overall perception of the overall picture. A framework for understanding. And that implies, when you say framework for understanding, you imply a framework is something that you maybe build a building, or you let roses grow, you let plants grow. It's a support. It's not one stick. It's quite complex. So you're hinting that the understanding depends on various factors making up this framework. And it is quite complicated here. Okay? And again, a likely mechanism. Okay, this is something we didn't know before. And what I said yesterday, to avoid through our knowledge, it's better to say to the best of our knowledge. Okay? I would, this is quite commonly seen in nature, but I would change it. If I were an editor, I would change this to the best of our knowledge, the first report. And remember, when you claim to be the first, you have to be very, very careful, because somebody else might say, wait a minute, somebody else did this before, okay? So that's why they're, again, this is the wiggle room, okay? If they say, and is the first report, then there's no wiggle room. But to the best of our knowledge, we might be wrong. Okay, sorry. That's okay. And then again, you're pointing out that almost nothing is known. Well, we all know virtual is in virtual reality, but virtually nothing is quite commonly used by native speakers, meaning close to zero. Virtually nothing. I know virtually nothing about the subject. I know almost nothing at all about the molecular mechanism controlling lymph agenesis. Okay? And it seems conceivable. Again, you could say it is possible. But it seems conceivable is a little more, I would say, academic. It seems conceivable that small changes in reticulum expression might potentially affect. And this could either accelerate or decelerate. So it seems conceivable. Again, emerging evidence, right? An emerging health problem. Emerging evidence shows that obesity is a problem. Emerging evidence suggests, and again, this implies that it is recent, it's a new thing, and it has been reported by other people, so you're talking objectively. And the accumulation of these cells in tumor predicts a marked reduction in patient survival, providing the smoking gun. In other words, the gun that has just been fired and there's still smoke coming out. So you can say this is definitely the cause. And this kind of phrase may not be in your own language, but it can appeal very much to a native speaker, the smoking gun. We quite often use it for irrefutable evidence. More and more people are using taken together, right? Together, these data are taken together. These data alter our perception and overturn the immunological dogma. Dogma means what has up to now been considered definite. Okay, dogma is the teaching of the church. It must be right. Can't be wrong. Yeah. So it overturns the immunological dogma. So this is a very strong statement. It doesn't suggest that there may be an alternative explanation. It overturns the dogma. This is a very hard-hitting word. If so, then this argues that vaccines may provide protection with reduced potential for immune-mediated change. And here we show, now this could be the beginning of a discussion. Here we show that TAZ10 transgenic mice, etc., resembling the hypothyroidism of Hashimoto's disease. But here we show, I mean, you're definitely saying that we are demonstrating this without a shadow of a doubt. To provide a rationale, these findings are a reason. Okay, rationale, again, sounds a little more educated, a little more academic. And you could use this very easily in an introduction. Provide the rationale for examining whether A influences B. The animal protocols were approved by, as I said before, yesterday, people are getting more and more strict about animal protocols. And yesterday, on the news, I saw that in America, they're very nervous about animals. Even England is a little bit overreactive about dogs and horses. And they found out that 27 animals had been injured or killed in the making of the new film, The Hobbit, An Unexpected Journey. But at the beginning of the film, there's the American Society for the Protection of Animals, and it says, no animals were injured or killed in the making of this film. But there were 27 killed or injured, so now it's a big problem. Also, The Life of Pi, the tiger almost died in the swimming pool. And that just came out yesterday. And also, no animals were injured or killed in the making of this movie. So, anyway, people are getting very much more sensitive about this issue. However, direct evidence, and again, you're not just saying evidence, you're saying direct evidence. That gives it an even stronger meaning. As is specific knowledge of the trafficking mechanisms for T regulatory cells. Again, a fundamental tenet, a basic belief, or a dogma, if you want, of immunology. But dogma, again, is even stronger than fundamental tenet, although they are similar. Tenet, like in a university, if you become employed for life, that is called having tenure, right? You hold the position. And this is a belief you hold, tenet, from French. So a basic tenet of immunology is that, okay? Now, I'd like to go to the New England Journal of Medicine and first of all, look at a section by section, introduction, materials and methods, results, and discussion. Now here the introduction is, first of all, you establish the gap. And as I said 2 nights ago, one of the best journals to look at for good examples of introductions is the New England Journal. They really write excellent introductions. there's no word wasted. And that is how you should try to write. Nothing wasted, like a diamond. Sharp, nothing extra on it, and cutting. That definition is from my sister. And then you explain the study and goals. So, we therefore performed a large-scale multi-center to examine the safety and efficacy of X in reducing the risk of Y in a broad population of patients and lesions. Okay? So that's what we set out to do. And as I said yesterday, you never put any of the results in the introduction. Okay? None of the results or conclusions. Again, you're trying to establish the gap. What do we not know? Okay, uncertainty. This is the first word. Ooh. Uncertainty. Well, what are we uncertain about? Well, uncertainty about morbidity and mortality, extent of benefit, and predictors of benefit led us to conduct or encouraged us to conduct. So in other words, there was this objective situation, and because of this objective situation, we were brought to do this. It was because of the situation that we did it. But this is a very appealing sentence because you're saying, oh, there's something we don't know. That's the very first word. And here we report outcomes for all patients who underwent randomization to identify subgroups of patients with varying levels of risks and benefits. And outcomes is something that we're all interested in. So again, this is at the head of the sentence. And of less importance is the subgroups of patients with varying levels of risks and benefits. We sought to determine the prevalence of this disease in Japan and to test the hypothesis. Now, very often, a reviewer might criticize a paper by saying, I do not understand the hypothesis. What was being tested? Okay? So here they are, in the introduction, they are specifically saying we wanted to test this hypothesis that it can be identified by serological testing in those who have not previously been diagnosed clinically. And again, it's not in children who have not been previously diagnosed, because you don't diagnose human beings. The children receive a clinical diagnosis. Okay? This observation, along with preclinical evidence, provided the rationale. That was the reason why we did this open label phase 2 study. So you've got this observation and preclinical evidence. Therefore, that was the reason why you did this. It's very clear why you're doing it. Again, this is a word that is very rarely used by non-speakers. Paucity, meaning a very small amount. There is a paucity of information. There is a paucity of data. There's a paucity of knowledge. Addressing long-term survival and the quality of life of survivors of such and such. And this is a good word to keep in your back pocket for when you want to use it. And here, again, you're establishing the gap by saying that this is the leading cause of death. It's the leading cause, not a leading cause, but the leading cause from a gynecologic cancer in the United States. So you want to know more about it, this leading cause. And stroke can cause substantial morbidity in children with sickle cell disease, even though maybe you might not think of stroke being associated with sickle cell disease, but they're saying that stroke causes substantial morbidity. So we want to do something about it. So here you've got 5 years of treatment with tamoxifen for breast cancer recurrence. It reduces the risk of breast cancer recurrence by 47% and the risk of death by 20% among patients with hormone receptor positive breast cancer. Now, today, the New England Journal of Medicine uses the symbol for percent. It doesn't spell it out, okay? And then, having given you this piece of information, despite these benefits, about half the men, it should be EN, so treated, relapsed. So there is a big reason to try to prevent relapse. Again, emerging evidence, accumulating evidence suggests, okay, that tumor progress is governed. And again, accumulating evidence, emerging evidence, this implies that new information that we are getting hold of recently has suggested this. Now, methods. Again, as I said, there should be nothing extra. And this guy, Dr. Strunk, in 1919 or maybe 1918, anyway, almost 100 years ago, he, in his book, Medical Writing, it's a small book, I think it's out of print, but he just said, omit needless words. Okay, it's just 3 words. Omit needless words, okay? I did 2 words. Write tight. Now that's bad English, okay? It should be write tight a little bit. Anyway, write tight, okay? So, between here and here, in 79, 2,197 patients with X were consecutively enrolled after their written informed consent had been obtained. So what you're saying is they're consecutively enrolled. Again, you're not what they call cherry picking. Cherry picking means you go to the salad and you like cherries and you don't take the oranges, you don't take the apples, you just go for the cherries. Maybe a kiwi as well. You don't just go for the tasty parts. They were consecutively enrolled, or 197 patients who met the enrollment criteria were consecutively enrolled, okay? After their written informed consent had been obtained. And the study and the written consent forms were approved by the Ethics Committee of YY. And again, as I said yesterday, you have to keep your, the day before yesterday, you have to keep all your lab data and clinical data, and that includes written consent forms. You have to keep those. You've got to store them. You can store them in film or in a computer or anything. Make sure you have backup of backup. But you have to keep them in case there's a problem 30 years later, 40 years later, even when you're 65 or 70 years old, that you did use proper consent forms. Criteria for inclusion were, right, so it's quite simple. Criteria for inclusion were, or enrollment, inclusion criteria were, or enrollment criteria were. And exclusion criteria, you can say exclusion criteria were, or patients were excluded from the study if, okay, you see both in your New England Journal. Patients who were, and then you say under 80 with a performance status of 0 or 1 and not receiving any treatment for other disease were considered for enrollment. Okay, and then you say all consecutive patients meeting these criteria were invited to take part in the study, and 205 agreed. So you're not just picking the nice parts. And this is a multi-center study, and even in the multi-center study, you have to give, each participating center has to approve with their own institutional review board. It's not enough that your institutional review board accepts it and then you have a multi-center study with other hospitals. That's not enough. Each hospital has to have it passed by their institutional review board. And consecutive eligible patients provided written informed consent. Again, you're stressing that their patients were eligible and consecutive, providing written informed consent, were enrolled. All patients provided written informed consent, and the study was approved by the institutional review board at each center. So all patients provided written informed consent. You're saying that right at the beginning of the sentence. And if you're doing a randomized trial, very often the reviewer will say, how was the randomization done? So it's better to explain exactly how you did the randomization. Randomization was performed by telephone and stratified according to the presence or absence of A and B. Or they were assigned in a double-blind fashion with the use of random serial numbers to treatment with either A or B. They may be minor points, but the reviewers are very interested, and they're responsible for not allowing a paper that has ethical problems to be accepted. So they might be more, they may be more detailed about their demands than you think is necessary. But it's, in the long run, they are really protecting you. So you should be happy if they are so particular. And for safety analysis, all subjects receiving at least one dose with follow-up evaluation were included in the safety analysis. And usually for randomized clinical trials, intent to treat, even one dose or sometimes even no dose, if there was intent to treat and they were originally included, you must include them in the overall evaluation of the results and the safety analysis. Now, results. So you're repeating a little bit from the materials and methods. You're saying a total of these students underwent randomization, and all of the patients randomly assigned to the A group and Y patients randomly assigned to the control group withdrew their consent and never received any study medication, leaving S patients in A group and T students in the control group. So you're being very clear about who were included at the beginning and who withdrew. But again, all patients have to be included in the safety analysis. Now here you've got over 3,000 patients, and you have selected certain demographic characteristics, and Table 1 shows those characteristics for all 3,500 patients. Table 1 shows the characteristics of the participants. These characteristics differ from population averages. Okay, now here the author is worried that the reviewer is going to say there was selection bias. He's afraid, or she's afraid, that the reviewer is going to say, wait a minute, this is surely not like the typical Korean population or the typical American population. There's something strange here. So to prevent that comment, what they're saying is, these characters differ from population averages. Yes, we agree, it's different from the population, but, they parallel the profile of persons receiving medical care in our institution. So this is a good way of preventing selection bias or accusation of skewing. Or you can say the characteristics of the patients were balanced among the three groups. And gastrointestinal events were typically mild to moderate and were manageable with routine support. Again, this is in the results, and you're indicating that there's nothing unusual. Now here, you're talking about grade 3 or 4 hematologic toxicity related to radiation. And 16% of patients was more likely to occur in patients with previous severe toxicity. Again, you're giving the reason for the high number of grade 3 or 4 radiation-related toxicity. And it was more in those with previous severe toxicity than those without such a history. And you're giving the p-value. So you're saying that there is a significant difference due to previous severe toxicity. And again, the reviewer is going to ask, please talk about the toxic effects. So this is to prevent that comment. Few major toxic effects were attributed to the drug XX. Most adverse events or adverse reactions, and remember, rather than side effects, it's more common to say adverse reactions or adverse events. It can be managed with the use of standard approaches, and the incidence of grade 4 adverse events was relatively low. And here, in your results, you're saying you're giving the reasons for ineligibility. I would put 5 as a numeral, 5 and 9. And I think many journals are moving toward that. It used to be that 1 to 10 you spelled out, and over 10 was given as numerals. But more and more journals are just saying all numbers give us numerals. It's easier to remember 5 than FIVE. And it saves space also. And the incidence of serious adverse events was similar in all groups. Serious adverse events occurred in 51 subjects, 34 of whom continued in the study while the event resolved without recurrence. Now again, as I said in the discussion yesterday, you've got to show the destination. What did you show? Today I was editing one paper, and the discussion started with European studies have shown that And I said to the author, no, the reviewer does not want to know what some Europeans have shown before. They want to know what you showed in this study. Why should the journal take up space publishing your paper? So our study provides reliable estimates of, right? And they're saying, why is it reliable? Well, because of the size of the sample, randomization, multiple institutions, well-defined measurements, long-term follow-up, low crossover rates. So we're saying we are confident in that our estimates are reliable. Or you can also say the results of this multi-center, randomized, controlled trial demonstrated A produces greater X than B. Okay, again, you hit the first punch of the discussion should be hard, and it should be right on target. You should be talking about what your paper shows. And you can also say this population-based screening study shows that this disease is underdiagnosed, so we have to do something about it. Okay, and in this study, they had a very large, very wide series of cases, and they had quite a few subgroups. And of course, reviewers sometimes say, well, how did you justify it statistically? Was there skewing in the subgroups? Was there bias in the subgroups? And so this is a preventive statement in the discussion saying, we understand that there are problems with subgroup analysis. Pitfall means a trap. We recognize the dangers of subgroup analysis. But we believe that the heterogeneity of the patient and outcomes and the considered approach we used make our findings clinically and statistically valid. So that's what we call a preemptive, to stop in advance, a preemptive comment to prevent the reviewer complaining about too many subgroups. But in general, it's better not to use too many subgroups because you will get complaints. Individual outcomes vary widely, but our study provides reliable estimates to guide physicians in making decisions about treatment. Now, this is something that almost all reviewers and editors want to get, something to help in making decisions on treatment, especially if it's something new. What can we do to break through this impasse? Now, this is a question, okay? Given the complexity and diversity of the healthcare system, there will be no simple solution. And this is an example of having a problem that you cannot solve. And the problem is based on the structure of the healthcare system, and you're saying that because of that, it's not easily solved. And sometimes you get, for example, we did one paper on donazepam for Alzheimer, and the maximum dose we used, the reviewer said the doses of donazepam are very low. Why don't you have a group with double your maximum dose? Well, under Japanese law, the maximum dosage was given. And the maximum dose is less than in the United States. So we can't change the law. So we just have to say, well, we gave the maximum dose possible under Japanese law, and we are unable to give any more. So take it or leave it. Or there was one paper I did today in which the reviewer asked for, did you do antibiotic resistance testing before the study? And the author had written pre-treatment antibiotic resistance studies are generally not available. Oh, okay. And then I asked, well, why? And he said, well, because in the Korean healthcare system, before treatment to do antibiotic resistance testing is not paid for by the government. So it would mean that the patient would have to come in one extra time, pay more money. So I rewrote the answer saying, under the Korean national healthcare system, this is not paid for, and therefore, if we perform this, it would be limited to a specific group of patients, which would result in probable skewing or selection bias, people who have money and people who have time. And so that was what we decided to put in. Now, I don't know if that will work, but it's usually better to explain. If you have a reason, people don't realize what the system here is, or the system in Japan, or whatever. And if you explain it, they are usually understanding. And here we have the novel Z inhibitor induces clinically significant responses with manageable toxic effects. Okay, so you get clinically significant responses and manageable toxic effects. And this is a very attractive sentence. Okay, you can benefit the patients and you will not have much toxicity. And this is, shows that trastuzumab can benefit women with HER2, HER2-positive breast cancer when given after completion of adjuvant chemotherapy. So again, this is a very clear statement of who can benefit. On the basis of our results, acute lung injury and acute respiratory distress syndrome occur with a higher incidence than previously reported. So you're talking about underdiagnosis, and they have a substantial impact on public health in the United States. So what you're saying is this is a major problem, and something has to be done about it. And despite improvements, there are unmet needs. Unmet needs. There are still things to do. Unmet needs. This is usually not seen in non-native speaker documents. Unmet needs remain, especially for patients who have not had an adequate response to XXX.